Hello and welcome to the Curated Beauty Podcast. I'm Jessica Christie, CEO of Beauty Culture Med Spa and the founder of the new functional and regenerative business, Cultured Wellness. From my start as a physician assistant to now not only being a practitioner but leading my own businesses, I've been on a unique journey through health, beauty, and entrepreneurship. Join us as we explore everything from skincare secrets to leadership lessons. Whether you're passionate about beauty or striving to balance life's challenges, this is your space to connect, learn, and shine. Let's dive in. Welcome back to the Curated Beauty Podcast. I'm your host, Jessica Christie, and I want to talk to you today about severe mental illness and perimenopause. Severe mental illness and mental illness in general has been a hot topic for the last decade and increasingly becoming an issue where we don't have massive control over physical and psychological symptoms that are associated with this, and very underdiagnosed, maybe misdiagnosed. It's kind of a guessing game in terms of putting people on the right therapies. And there was a study that came out of Cambridge University that really was talking about there's a lot of hormonal fluctuations in perimenopause that are associated with an array of not only physical, but also psychosocial and psychological symptoms. And people who are going through these changes or people who have pre-existing mental disorders may really experience a change in their symptoms and response to these treatments during periods like perimenopause and postmenopause. Not only that, we have a risk of poorer, longer-term physical health outcomes with menopause. And so there's really starting to be this collaborative approach, or needing to be one, between primary care and secondary mental health services as an opportunity to really be proactive and have the discussion. This could involve some lifestyle measures and or hormonal replacement therapy, which can lead not only to an improvement of overall health, maybe making sure that we're not misdiagnosing someone and putting them on unnecessary psychotropic drugs, but also say someone does need those, then let's make sure that we're maximizing the dose that they're on before just upping the dose. Are there other things going on? And so when we think about perimenopausal hormonal fluctuations, this is really going to potentially lead into new onset of mental disorders or affecting these pre-existing conditions. Hormone replacement therapy alongside really relevant psychotropic medications can lead to this better well-being. And so this study really looked at menopause, obviously, is when menstruation ceases. And this is all because there's a reduction in hormone production from the ovary. So it's ovarian failure. And when we're no longer producing hormones, we're not in our reproductive years anymore. This perimenopausal phase is almost this variable time frame. And during that time frame, we may still have estrogen, but we have a fluctuation of other things like progesterone and testosterone. And this really is starting to happen much earlier than what we think of as menopause. You would never think a late 30s female would be worrying about, is my mental health from hormonal changes, because she's thinking, I still got my estrogen, I'm still getting my period. But really, this is the time where we see progesterone drop off, especially in those second stages of the menstrual cycle. And we're not maintaining a pregnancy and about to start menstruation, and also of testosterone. And so actually, we're starting to see this earlier and earlier, probably for a variety of reasons. Very likely our horrible toxic environment, endotoxins, exotoxins, hormone disruptors in every single product that we use on our bodies that's absorbing through all of our hair follicles, just to name a few. Nanoplastics, microplastics. The other day, I read something where if you literally get a coffee from Starbucks, if it's a cardboard cup, water would go through that. It doesn't. You can leave it like for 3 days and it's not going to leak through. Well, it's because there's plastic inside the cup. And as soon as you put a hot beverage in there, obviously that's going to melt a little and suspend some of the plastics, and then you drink that. So if you're getting Starbucks every day, you may want to think about asking for a Yeti or getting coffee from home that you like. Invest in the good coffee pot, in organic coffee. Not to go off on a random tangent, but coffee beans are literally one of the most heavily sprayed pesticide crops on the market. And so you really want to make sure that you're getting organic coffee if you're drinking it at all. The psychological symptoms that can be thought of to be related to menopause include anxiety, low mood or just depressed mood, paranoia, anhedonia, which means not enjoying or lack of interest in activities previously enjoyed, irritability, dissociation, insomnia, feelings of really low self-worth. These are because of hormonal changes on the brain, and psychological symptoms can really be affecting these pre-existing conditions that people already have. So we look at estradiol and progesterone and testosterone as being very important hormones on brain function. And estradiol, most notably, has a very important role on regulating serotonin, which serotonin pathways are thought to be involved in the neurologic basis of depression. We also look at other neurotransmitter pathways like GABA. So those are linked to changes in mood. And this is really where we look at progesterone being a big regulator of GABA. And then, of course, we have testosterone, which really gives us that improvement of psychological well-being, and also is the one that we look at in terms of really talking about sexual desire disorder. These are really impactful hormones. To consider the loss of these, we're going to have a massive increase in psychological distress. And not to mention differences in sleep. So insomnia with progesterone leading to that downstream GABAergic effect. This is going to result in improved sleep. So improved sleep can obviously massively improve our emotional resilience, as we can imagine. But this isn't to shame or say that anyone on any antipsychotics don't need them or there's not a place for them per se. But I think that when you look at someone who's struggling with these things, they don't have an SSRI or an antipsychotic deficiency, but they do have deficiencies in these hormones as we age. And so when you're looking at things like anxiety or low mood or brain fog, it's really important to consider the implications of what these other hormones could potentially be doing and to run this panel. And that's just not happening. I had someone this week a male tell me, I asked for my testosterone to be checked and they just flat out told him no, and that he's not old enough and that he doesn't have any symptoms. And they literally prescribed him, because of the symptoms that he did have, a antidepressant. And then it took him a long time to get off of that. And he was experiencing brain zaps. I had another female tell me that she asked for her doctor to check her hormones, and they literally pantomimed, go like this to your chin and kind of brushing your chin like a thinking motion. And they said, do you have a beard or do you feel hair? And she said, no. And they said, well, you're good. You don't need your hormones checked, which is crazy. These are physicians, Western medicine trained physicians, family practitioners, internal medicine, that are not abreast of the situation that we have hormones that are declining and people are asking for them to be tested, and it's not part of the run of the mill because they don't know what to do with the information. Also, just to mention, estradiol, estrogen is a really potent neurosteroid, and it tends to be very neuroprotective. And when this is low, whether people are premenstrual, postpartum, peri and postmenopause, this is really massively associated with that increase in depressive and psychotic episodes, especially in women. And when we branch off of that, we have things like schizophrenia, depression, bipolar affective disorder. Going back to depression for a second, there's a lot of patients with pre-existing depressive disorders that are really at risk for relapsing in symptoms in this perimenopause period. And they find that their antidepressants, which had previously helped them, are no longer effective. And then their doctor does what? Writes them a higher dose. So we really look at things like a suicide rate being seen in women. The highest rates are 45 to 49 years old. Well, what's happening during that time? It's the perimenopause time. And we're giving these people higher doses of antipsychotics when really there's a high likelihood that they need hormone replacement. Maybe not estrogen yet, but really balancing the other ones and supporting natural ways to bring that estrogen into balance. When we look at anxiety being the hallmark of perimenopause, that's another one that is really linked to the vasomotor symptoms like hot flashes. Anxiety symptoms preceding the onset of those vasomotor symptoms are really, really common. And so being able to give a really great solution would minimize some of those hot flashes. Trauma is another thing that we can relate to subsequent mental disorders. This also has a massive impact on the reproductive system. And I think that it serves to mention that estrogen may play a part in the stress vulnerability model and modulate the downstream effects of childhood trauma, whether it's physical or psychological sequelae during life. And so
that can really be something that can need a deeper dive into what the history is of someone, but we don't take histories because we're too busy. We look at neurodiversity and increased sensory sensitivities as we become an age where ADHD and other neurodiverse conditions are becoming more and more popular in not just males, but also females. And this makes patients more vulnerable to the perimenopause associated symptoms. And then, of course, we have the physical health risks that I always want to bring back. Estrogen, progesterone, and testosterone are declining in perimenopause and into menopause. And when we have people that are postmenopausal, they are 100% at risk for osteoporosis, cardiovascular disease, diabetes, and cognitive decline in the form of Alzheimer's, dementia, and other forms of dementia. And when we look at the impact of this and the overall decline in well-being, of course, that's going to contribute to poorer physical health. Mental illness is already causing us to recognize people to have a reduced life expectancy. They're usually having some sort of worse level of physical health, usually with respect to the cardiovascular system. When we really look at physical health implications of hormone replacement therapy, there's just been such a plethora of negative press coverage over the last 20 years since the Women Health Initiative trial. And I'm going to talk about this a lot because if someone missed a previous podcast or just doesn't know or doesn't fully understand what went down, it's really important to recognize that this randomized control was understood to cause potentially risk of DVTs or those thromboembolic risks or blood clots or breast cancer risks. But what happened is we have a mistruth that really came out. And when the data was reanalyzed, we can see that the benefits of hormone replacement therapy are more readily appreciated and are causing massive benefits, but we still have that fear of it being prescribed. And the gold standard really truly for people who are on the decline with hormones is hormone replacement therapy. And we really like body identical or bioidentical hormone replacement therapy in either the form of transdermal patches or gels or sprays or micronized progesterone capsules, whatever. We love the Quicksilver supplements at our practice. They have a whole hormone line, and I love the liposomal nanoparticle delivery system. I love, love, love it. But when we look at the vaginal preparations for genitourinary symptoms with menopause and how much that affects well-being, you tell a man to just deal with his erectile dysfunction, but likely there's women that go through menopause and they have painful sex for the rest of their lives unless someone intervenes. We have transdermal testosterone. We have all of these things that can really just replace these hormones so easily and really improve the symptomology to improve the quality of life. And not only that, but actually now when we look at the data, it reduces the risk of osteoporosis and cardiovascular disease, colon cancer, type 2 diabetes, cognitive decline, and it does not increase any risk of blood clots or increased risk of breast cancer, which is why it was stopped before. I guess my call to action is for, as a patient, if you are in these stages of life and you're experiencing any of the symptoms that we talk about on Instagram or in these podcasts, please get your hormones checked. Find someone that you trust to do it. We are up and running at Cultured Wellness, and we are more than willing to do virtual consultations. We do need to lay hands on our patient at least once, but we have a lot of out-of-state patients that we feel comfortable once we've gotten that initial exam, especially for testosterone, to be able to continue your care from afar and make sure that you're getting labs that you can have done at a number of places that we can check over and do check-ins with you and make sure that you're on the right therapy and the right dose. I think also I would encourage physicians to put their heads together with other physicians, and instead of just all being this specialty, really look at a patient as a whole and consider hormone replacement therapy as maybe some of these issues with mental health crises that we think that they just need another psychotropic drug. And I really am just excited about what we're doing because I think that any patients in perimenopause with a history of mental illness, there's definitely a danger of diagnostic overshadowing or new onset perimenopause symptoms being diagnosed as a relapse of a mental condition. And that's going to take a toll on a patient for feeling like, gosh, I just can't get it right when really it's just your body not functioning appropriately. I think when we can prioritize treatment in terms of bringing the whole health picture together, we also normalize that mental health is part of health in general. And it brings it back to the forefront that it's an important field of medicine and it's not just for cuckoos. And this also isn't to shame anyone who's on any sort of antipsychotic or psychotropic drug in general, because I recognize that there's a lot of things that go into it. But when you're able to heal your body and heal your gut and heal your mind and replace it with what it's missing, that's the whole concept of regenerative medicine. Your body has the tools to heal itself if you give it back what it's asking for. So with that, I encourage you all to get your hormones checked. I hope that this was an episode that shed some light on a sensitive topic. And I hope that you continue to tune into these episodes because I think that this is information that you're not getting a lot of other places. And I'm committed to going out and finding all of it and reading all of the studies. And then with my team, putting our heads together to bring you the best care.
And that's a wrap on another enriching episode of the Curated Beauty Podcast. If today's conversations resonated with you, I urge you to share it with someone you believe could benefit from it. Let's spread the beauty, knowledge, and empowerment far and wide. For more in-depth resources, information about who we are, or if you're interested in becoming a patient or training directly with me or one of my team, visit our website at beautyculturespa.com. Don't forget to stay connected with us on Instagram for all the latest updates, behind the scenes, and beauty wisdom. Follow us at beautyculture.medspa and at B Cultured Wellness. That's the letter B, Cultured Wellness. Thank you for being with us today. Keep curating your beauty both inside and out. Until next time.